Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to talk about is called the causes of acute abdominal pain in adults. Acute abdominal pain in adults. So whenever you go to a GP with any kind of symptom, GP has got five kinds of diagnosis or steps of diagnosis or a safe diagnostic model or approach in their mind. So number one is, what is the probability diagnosis? Like, what is the most common cause of this symptom? Number two is serious disorders not to be missed. Number three is pitfalls. Pitfalls means the diagnoses which are often missed. Number four is seven masquerades. I have already spoken to you about seven masquerades and I'll come to that in a minute. And then number fifth is the patient trying to tell me something? So five things that we keep in our mind. It is called John Murtagh safe diagnostic model or approach. Number one, what is the most probable or what is the most possible diagnosis? Then number two is serious disorders not to be missed. Number three is pitfalls. Pitfalls means the diagnoses that are often missed and we should keep them in mind so that we do not miss them. Number four is seven masquerades checklist. And number five is the patient trying to tell me something else that I'm not getting? Okay. When you go with acute abdominal pain, so as you know that abdomen is the region, it has got 9 different quadrants. Epigastric, right upper side and left upper side, then umbilical, then middle right side, middle left side. They have all got their own names, and then we've got the lowermost part, and then it has got the lower right side and lower left side. I'll come to the names of the quadrants and then which quadrant is most likely to have what kind of pain, what organs are there. I'll come to that bit as well because they have all their names like epigastric, umbilical, lumbar, hypogastrium, and all these kind of stuff. So I'll come with the whole picture in front of you. But today what I'm going to quickly discuss is what is, whenever you go to a GP practice or a GP with acute abdominal pain, what is the probability diagnosis? So number one is acute gastroenteritis, which is, I have already spoken about it yesterday, that acute gastroenteritis is gastro, which could be of two types: viral, which we call as the stomach flu, or bacterial, which we also call as food poisoning. So that is the number one diagnosis of acute abdominal pain. Number two is acute appendicitis, so appendix, inflammation of the appendix. Number three is dysmenorrhea. If it's a female, it's dysmenorrhea or related to the genital tract. Mittelschmerz is one of the other ones, but dysmenorrhea is number three. Then we've got irritable bowel syndrome. Then number four is biliary colic or kidney colic. Biliary colic is related to liver, gallbladder, and biliary tract. Colic of that entire pathway, or kidney colic or ureteric colic is also at number 5. So probability diagnosis, number 1, you could have acute gastroenteritis. Number 2, acute appendicitis. If you are a female, then Mittelschmerz or dysmenorrhea. Number 4 is irritable bowel syndrome. And number 5 is biliary colic or renal or kidney colic. Now, serious disorders not to be missed. And in my case, one of the serious disorders that I do not want to miss in any female of reproductive age is pregnancy, and most probably ectopic pregnancy. Because normal pregnancy usually does not cause pain of acute abdominal pain. So it's the ectopic pregnancy, which is outside the uterus, which can cause bad acute abdominal pain. So I always make sure that in the reproductive age females, I do the beta HCG, the blood test for pregnancy, or ask them about it. Like if the female is not sexually active, that's another thing. But if they are sexually active, even though if they are on contraception, I would make them to do a urine pregnancy test there and then. If not, then we will do a blood pregnancy test. If I'm going to do blood test, then I'll definitely do a blood pregnancy test. So ectopic pregnancy should not be missed in cases of acute abdominal pain in reproductive age females who are sexually active. Even though they are on contraception, that doesn't matter because contraception methods can fail. Then other serious disorders not to be missed are cardiovascular. So a heart attack. A heart attack can also present as an acute abdominal pain. So we have to make sure that it's not a heart attack. Then there are other conditions also cardiovascular, which is a ruptured aortic abdominal aneurysm. Then we've got dissecting aneurysm of aorta, mesenteric artery occlusion and ischemia. These all vascular, cardio and vascular causes should be kept in mind. Then of course cancers, large or small bowel cancers, stomach cancer, cancer of any of the organs in the abdomen. Then we've got severe infections like acute salpingitis, infection of the fallopian tubes, bacterial peritonitis, then biliary tract infections, then intra-abdominal abscess. Then pancreatitis is very, very important. Then we've got small bowel obstruction or strangulated hernia, sigmoid volvulus, perforated viscus. So these are the serious disorders that should not be missed. In my case, I really make sure that 3 of them are not missed. One is ectopic pregnancy, one is heart attack, and number 3 is any kind of tumor or neoplasia. Then pitfalls often missed are you can miss acute appendicitis according to John Murtha, fecal impaction in elderly, herpes zoster, shingles, and pulmonary causes. So as the heart causes can cause abdominal pain, similarly lung causes can cause abdominal pain as well, like pneumonia or pulmonary embolism. Then others are lead poisoning, hemochromatosis, and other conditions. Then 7 masquerades checklist. I said that always making a diagnosis, a GP should have these 7 things in mind. Depression, diabetes, yes, ketoacidosis. Diabetic ketoacidosis in type 1 diabetics is a very common cause of abdominal pain. Drugs, especially narcotics, opioids can cause abdominal pain. Anemia, sickle cell anemia, yes. Endocrine disorder, thyroid conditions can sometimes cause. Spinal dysfunction, yes, referred pain can come from back there. And UTI, urinary tract infection, is very, very important, including urosepsis, because UTI can definitely cause a middle or lower abdominal pain. Then, is the patient trying to tell me something? Consider Munchausen syndrome, sexual dysfunction, and abnormal stress and anxiety. So this is how we work up acute abdominal pain, in whether it's in any quadrant of it. Of course, when we come to different quadrants, like upper abdominal organs are different, lower abdominal organs are different, middle abdominal organs are different, and every cause, like for example, acute appendicitis has got a very specific, so it starts around the umbilicus and then moves towards the right side, but that's not always the case. So we have to really have everything in mind. So if it's upper abdominal pain, then we also have to keep in mind that it shouldn't be a heart attack, it shouldn't be anything related to lungs, it shouldn't be a pancreatitis, so stuff like that. So yes, but in my case, in the takeaway messages that number 1, if it's a female, if it's in the reproductive age group, sexually active, ectopic pregnancy should not be missed. Then of course a heart attack should not be missed, a lung condition should not be missed. Just because it's not in the abdomen, it doesn't mean it cannot cause abdominal pain. Acute appendicitis is something we overlook in adults. We think about it all the time in kids, but we do not think about it in adults. Lower abdominal pain, we can think about UTIs, and yeah, and all of that I told you. See you next time.